Away from politics, a bill to prevent Nigerian-trained medical or dental practitioners from being granted full licenses until they have worked for a minimum of 5 years in the country had passed second reading at the House of Representatives. The bill is part of the measures to halt the increasing number of medical doctors leaving Nigeria for other countries in search of greener pastures. The bill is being sponsored by House of Representatives member Ganiu Abiodun Johnson. The second reading was taken on the floor of the House in Abuja on Thursday. Johnson told the House that it was only fair for medical practitioners who enjoyed taxpayers' subsidies on their training to give back to the society by working for a minimum number of years in Nigeria before exporting their skills abroad. The majority of lawmakers supported the bill, though a number of them called for flexibility and options in the envisaged law. As reactions continue to trail the House of Representatives bill seeking to prevent Nigerian-trained medical or dental practitioners from being granted full licenses until they have worked for a minimum of 5 years in the country, Dr. Christopher Otabo, a medical consultant, says the bill, which has already passed second reading at the House of Representatives, is dead on arrival. He stated this during an exclusive interview with Clearview News Desk this Friday in Abuja.
In recent times, Nigeria has experienced a massive brain drain in its healthcare sector, which has brought significant disruptions to its healthcare system. According to statistics, Nigeria currently has only 24,000 licensed medical doctors available in the country, less than 10% of the number needed to meet the World Health Organization's recommendation. In a bid to address the lingering issue, the House of Representatives at a plenary passed a bill in second reading to mandate medical doctors to practice in Nigeria for at least 5 years before moving abroad if they so wish. The proposed legislation, titled Bill for an Act to amend the Medical and Dental Practitioners Act, was sponsored by Honorable Ganiu Johnson. In his lead debate, Johnson said the proposed legislation seeks to cure the exodus of brain drain and build the manpower in the medical sector.
Medical or dental practitioner to practice in Nigeria for a minimum of 5 years before granted a full license by the council in order to make quality health services available to Nigeria.
The news has since elicited mixed reactions from Nigerians and medical practitioners across quarters. Speaking during an exclusive interview with Clearview News Desk, Dr. Christopher Otabo, a medical consultant, says the proposed bill by the reps is one dead on arrival.
It does not have the capacity to say true because, to start with, it's a breach of the fundamental human rights of doctors. If I have passed my exams and I have met what the law says, there is an act that established the Medical and Dental Council, which he wants to repeal. But that act is in line with the Constitution of the Federal Republic of Nigeria. I cannot pass my exams and meet the requirement, and we are withholding my full registration for 5 years. It doesn't make sense. Why would a young doctor want to leave? Because he doesn't see a future. He doesn't see a future in the country. Before now, when a doctor graduates, he is sure of getting a place to do his youth service, his housemanship. He is sure of getting a place to undertake his postgraduate training. We call it residency training program. Because teaching hospitals are not funded, so they cannot use the number of slots they have. Some teaching hospitals have slots to train 100 doctors per time, but they cannot take more than 20 doctors because there is no money to pay them. And so if these doctors keep roaming about, not having a place to be trained, to become consultant, because it's when you become specialist that the profession is actually more enjoyable and you become more impactful. When such opportunities are not available, they leave. You should be addressing why are the doctors leaving? Because they don't have places to train. for their postgraduate training. Why? Because their salaries are poor. A doctor here earns on the average $300 in a month. If it's up to, in many places, they don't end up to that. But where they are going to, they can pay them as much as $5,000 a month. How can you convince such a person not to leave?
He, however, called on the federal government to focus more on addressing the root causes of brain drain and other issues affecting Nigeria's healthcare sector.
What I expect the honorable members and the senators to be doing first is to declare a state of emergency in our healthcare system. If that is done, they should look at funding critically. What are the gaps? How can we bridge the gaps? They are there. They said they hold the knives and they hold the yam. They are the ones that are appropriating money. They should not only think of appropriating money to themselves, they should think of appropriating money to the healthcare system. Teaching hospitals are languishing. Not many have basic equipment, CT scan, MRI, they don't have it. They should be mandating hospital centers to open up the space for residency training. A doctor that is undergoing his residency training program, he knows that he's going to become a consultant, a specialist. He's not going to be in a hurry to leave. In the same vein, they should also legislate that no honorable member or government officers, whether appointed or elected, should leave the country for medical care. So we know that we're all here together. But they won't agree to that. We've proposed that many times. If you want to stop medical tourism, the first thing is to block any government official or their children from going abroad. When you do that, you will see that the required attention to the healthcare sector will be given. And then, if they do that, if they can pass that, I will support that doctors will stay. Because doctors will naturally stay.
The brain drain in Nigeria is quite alarming and translates into a very poor doctor-patient ratio for a country with a population of over 218 million people. According to reports from the Nigerian Medical Association, only a quarter of the over 93,000 doctors produced by Nigeria are currently practicing. In the last 8 years, over 10,000 medical personnel have migrated to the United Kingdom alone, and thousands continue to troop out, seeking greener pastures in other parts of the world. It is therefore important for relevant stakeholders to work together in finding a lasting solution to the issue.